Hello, good morning, good afternoon, good evening, depending on when and where you're watching this video from. I'm Dr. Katie, you're already home. There is something for us to learn today. Of course, that's why I'm here. Today, we're going to be talking about very important topic in the life of men as they age. Today, we'll be talking about the health of the prostate. You can say prostate health. And we're going to be discussing this in general terms, and then we'll talk about prostate enlargement, we talk about prostate cancer, we talk about prostatitis, infection of the prostate, and then we'll now round it up by talking about food that are healthy for prostate, food that are important for prostate health. All right, if you cannot finish in one lecture, we're going to do that in another lecture. So prostate is an organ found in a man, just like cervix is found in a woman. Prostate is not a disease in itself. Like I've seen a man told me before, he said, I have prostate. It's wrong, sir, because you are supposed to have prostate. Every man will have a prostate. It will only be a problem when you now say, I have prostate enlargement. Okay? And then the symptoms that will not follow will not say, yes, you have prostate enlargement. And this enlargement can be two. There's one enlargement that's not a cancer. They call it benign prostatic hyperplasia, or benign prostatic hypertrophy, or prostate enlargement. And there is another one that is a cancer. They call it prostate cancer. And it's possible too that the prostate is not enlarging. There's just an inflammation going on there in the prostate. They refer to that one as prostatitis. So we're going to be talking in two phases. We're going to be talking, one, for people that are yet, or people who don't have enlarged prostate yet, so that they will have information and prevent or downplay the need for their prostate to be enlarged. And then we'll talk to people who have prostate enlargement already and the way forward. And then we'll talk to people who have prostate cancer. So prostate cancer and prostate enlargement, one group, because they have a problem already with the prostate. While others that are yet to have a problem, we know the general info, prevent disease, and live and manage health otherwise. So the prostate is a walnut-shaped organ found in the pelvic area or perineum of a man. It is actually at the neck of the bladder. Some people will call it neck of the bladder, others will call it apex of the bladder. Okay, the bladder is an organ in the body of every human being that collects the urine. So the urine that is collected in the bladder will be urinated through a part referred to as the urethra, and that urethra is the pipe that is connecting the bladder to the outside so that you can wee or pee through it. The reason why I need to emphasize that is that there is another name that is similar to this in the body. They call it ureter. Ureter is the pipe that connects the kidneys to the bladder, while the urethra is the one that connects the bladder to the outside so that you can wee out. The urethra is the part that urine or sperm passes in a man to the outside, while for a woman, urine only passes there. For a man, sperm and urine. So the prostate is at the apex or at the neck of the bladder, immediately lower than the bladder, in front of the rectum. The rectum is one space in the guts or in the intestine, let me call it intestine so that you can understand, at the last part of the intestine, where feces, fecal matter, stool, our poo is packed before we poo them. It is when our rectum is full with feces that we are pressed, we want to quickly go to toilet to go and poo and empty it. So that rectum that stores the fecal matter is behind the prostate. I'll tell you why that is important for you to understand. So the prostate surrounds the part of the urethra that is referred to as the prostatic urethra. That's where it got its name from. So the prostate function is to secrete fluids that helps to add to the semen when it is produced. So what it means is that the secretions from the prostate supports fertility in men because it contributes to the volume of the sperm. And so, though the clear function of what that fluid does in the sperm is not known, but it produces secretions that are added to the semen that is ejaculated to get to its final destination. So the prostate has various parts. It has the lateral, you can call it lobe, Okay, it has the lateral, left and right lateral, it has the median part of the prostate, and it has a gland that is surrounded by some fibrous muscular layer that surrounds it. There are two phases of growth of the prostate. One is at early puberty. At early puberty, the size of the prostate doubles, while the second phase of growth of prostate is when the individual is 25 years. After 25 years, the prostate will start growing in every man. So with increasing age, prostate will start growing. The percentage, 50% of men will have prostate enlargement between the age of 51 and 60. While 90% of men will have prostate enlargement after the age of 80. So it is a factor, or it's a prostate enlargement is a component of aging. What it means is that with increasing age, there's increased risk of prostate enlargement. Prostate enlargement is common because it's there, almost always there when the man is aging. And the symptoms that will be associated with prostate enlargement depends on whether or the size of the prostate and the obstruction to the urine flow. That will determine the symptoms that will be associated with prostate enlargement. Like I said, it is a common pathology, if I should call it pathology. The prostate, about 14 million men presented in 2010 in America with lower urinary tract symptoms, which are symptoms that are associated with prostate enlargement. So what are these symptoms? Don't forget that prostate enlargement is common with Black Americans compared to the others. Okay, so what are the symptoms? These symptoms are hardly ever found before the age of 40. They are not there before the age of 40. But after 40, 45, then you can see some few people manifesting symptoms. Symptoms are associated with enlargement of the prostate. And with increasing age, the symptoms will begin to ensue, or you begin to find it common amongst men. In fact, after the age of 60, 1 in every 3 men will have a prostate enlargement. So what are the causes of prostate enlargement? The true cause of prostate enlargement is not clear, but there are several associated factors. There are factors that are associated, we call it risk factors associated with the enlargement of the prostate. What are they? It is said that family history is very significant. People who have family history of prostate enlargement, maybe your father, your uncle, your brother, there's a higher risk that you will also have prostate enlargement compared to people who do not have family history. 2, men who are obese, who are overweight, are at higher risk of having prostate enlargement. Men who are not exercising, they don't have routine exercise, okay, they are at higher risk of having prostate enlargement. It has been seen that the hormonal imbalance associated with increasing age of a man is actually the etiology or associated risk of developing prostate enlargement. In a man, testosterone is produced, and testosterone is higher than the estrogen that is produced because testosterone is the hormone that is found in men, while estrogen is the hormone that is found in women. So this estrogen is low or few or less, depending on the word you want to use, in men, while the testosterone is higher because he's a man. But as they age, the testosterone will begin to drop. As this testosterone is dropping and the hormonal imbalance, because the estrogen is now almost getting more than the testosterone, they said this supports the growth or enlargement of the prostate. When the risk of prostate is there, what are the symptoms? Or when prostate is already enlarging, what are the symptoms of enlarged prostate? 1, the stream of urine. You don't need to cram it, just look at it. When you were younger, when you are peeing, you see that your pee, you start here, will be far away, will be dropping very far away. But now, it's almost on your legs, okay? You don't have good urine stream. It's one of the symptoms of a large prostate. 2, when you go to the bathroom or when you go to ease yourself in the toilet, you have to wait for the urine to come out, okay? You wait until it's able to find its way through the narrow part before you now start peeing. It's a symptom of enlarged prostate. 3, dribbling. As I tell you, are finished peeing, you now see some urine still be dribbling. And this is the reason why people that are not very clean, their pants will always smell, or their boxers will always smell urine. You know, you are done peeing, it will still be dribbling. You'll see this drop of urine at the end of peeing that can wet your boxers, that can drip on your clothes, even when you are done peeing. 4, incomplete voiding. You'll be feeling that it's like you don't empty your bladder yet. You know what actually happens in that case? It follows through a process. When the enlargement is just starting, it will result in the thickening of the wall of the bladder. You know how? You know, the way that the urine is going to pass out is already narrowed. So the bladder had to contract to be able to push the urine against that obstruction. So that contraction that the bladder is always doing will now result in thickening of the bladder wall. But do you know what will happen? A time will come that the bladder will get tired of doing this job and it becomes weak. When it's now weak, there will not be urine after every voiding. When you are finished urinating, there will still be urine in your bladder. And this is what actually predisposes the individual to urinary tract infection, because those urine that are remaining, but microorganisms can grow on it, then there will not be infection. How do you now know that there is infection? When you now find pain, when you are peeing, pain during ejaculation, pain, there can be blood in the urine too. There can be blood in the urine, like earlier said, and pain, and lower abdominal pain, pelvic pain, that area where you have the prostate and the organ of a man, you feel pain in that area. It's a sign that infection is already there, or it's a sign too that it might be a cancer, if for example there is no infection. Okay, we'll get to that later. So another thing is urgency. Another symptom, you are not able to hold urine. Immediately you are pressed, you run to the toilet. Before you get there, you can wet yourself. Okay, you can be drenched with your urine. It's another symptom. Another symptom of enlarged prostate, you can have pelvic discomfort because something is already swelling there. Pelvic discomfort. You can have pain on ejaculation too sometimes, especially when there is infection. It becomes really bad that there are some acute events that are associated with enlarged prostate. When there is acute urinary retention, what that is that there is complete obstruction to urine flow, such that you are making urine, it's not coming out. The bladder becomes so tense and the patient or the individual becomes very uncomfortable. You'll be crying, you'll be tense, you'll be running around. Oh my God, you're not able to pee. Okay, that's acute urinary retention. They need to now take you to rush you to the hospital because your tummy will be so tight, especially at the lower part of the abdomen where you have the bladder. It's very tight. Your bladder is full, but urine is not coming out. They need to now take you to the hospital and find another way for the urine to come out so that you can have initial relief. That's an acute urinary retention. You know what chronic urinary retention will do? When the bladder is gradually filled up, there will not be a backflow of urine. Since there's no way for the urine to go out, urine will begin to go back to the kidneys that are producing it. That ureter I told you that connects the kidneys to the bladder, urine will not stay there. It will keep producing, the kidneys will keep producing urine as long as you are drinking water and you are alive, until the urine gets to the kidney itself. So you now have first hydroureter, that's water, urine in that ureter that connects the kidney to the bladder. Before you know it, you now have hydronephrosis, meaning urine in the kidneys itself. It can actually cause a kidney problem where there will not be renal impairment. That meaning the kidneys will not be affected and will not be working optimally again. When you do kidney tests, they will not give you symptoms, results that are showing that your kidney is becoming injured from lower urinary tract obstruction. Okay, because urine is not flowing out. These symptoms, when it comes to prostate enlargement, there's a time you begin to watch, watchful waiting if the symptoms are not disturbing life. And what are the ways to that? You now have to go through some lifestyle changes, lifestyle modification. All right, your prostate is increasing, it's enlarging. You are beginning to see that your urine stream is not going well. It doesn't go far again. You are peeing close to your leg, it's dribbling, the urine is poor. Before, when you used to pee, you see the rush of the urine coming like a heavy tap. This time it's narrowed down. It's not coming that plenty again. You're beginning to notice that, but you're still able to pee. You don't have pain, you don't have much discomfort. What you have to do at that time is lifestyle modification. And you are beginning, maybe you begin to have urgency too, worrying to pee, and there's increased urine frequency, there's nocturia. You always wake up to pee up to about 6-8 times at night, and this will interfere with good sleep. And when you don't have good sleep, it will begin to stress you up. Your blood pressure might begin to rise. Anything that will interfere with your sleep will begin to affect your body and give you systemic disease and all the other things. So if you're not sleeping well because you have to wake up 6-8 times to pee, you know, lifestyle changes can help you. For example, you don't drink water in the evening when it's late. All the water you have to drink plenty water in the morning, so that before the evening you must have wheeled them, you must have peeled them, and you have adequate water consumption for the day, so that you won't have to wake up too many times to wee at night. That's lifestyle changes. Another thing you can do, you will avoid alcohol. Anything that will irritate the bladder, you should not be seen to be drinking alcohol. You should not be taking caffeine, because this on their own will give symptoms that look like lower urinary tract obstruction or lower urinary tract symptoms. So you avoid caffeine, you avoid alcohol, okay? And if you have events that you are going, you have occasion, for example, you are going for marriage, you won't go and drink water, plenty water before you go there. You'll be surprised that the clothes you're wearing for the event, in the course of trying to ease yourself, you have wet it and you'll be embarrassed. Okay, you have occasion, you are going, you have a marriage ceremony, you are going to church, you might not have to drink water until you come back home. Then drink enough water. When you have to pee, you go to the toilet or the bathroom to ease yourself. These are lifestyle changes, and there are diets that support the prostate health. I took our time to find that for you. It has been seen that the ginger, garlic, they are good vegetables, okay, that they are very good for the prostate health. Onions, garlic onion too is good for the prostate health. Green vegetables like broccoli, cauliflower, kale are said to be good for the prostate health. Okay, it is good to eat these meals that are in support or that supports prostate health. So watchful waiting, like I said earlier, is the goal until symptoms are now disturbing life, and now preventing you from having good sleep, or preventing you from carrying on with your normal activities. And something you must know, when you have lower urinary tract symptoms, these symptoms I've talked about, this urgency, frequency, and not being able to sleep well because of having to go to the bathroom, you need to see a doctor, because there are several things you should do in order to follow up with your prostate health. One, when you are above 40, you should be able to do routinely what they call prostate specific antigen. The normal one is between 0 and 4 nanogram per ml. There are values that are in keeping with only prostate enlargement. There are values that are in keeping with cancer. This is because early diagnosis of prostate cancer can actually help you achieve a cure for that cancer. Early diagnosis can play a role in the management of prostate cancer. So you must not wait until it has become an advanced disease before you go ahead for your routine investigation. And when I was talking about the tests that you do, I have a video on tests that you do when you go for routine hospital checkup. Prostate specific antigen is part of the routine that you do when you go for hospital checkup, okay? Routine hospital checkup, especially when you are above 40 years. And when you do this all the time and you diagnose malignant transformation or anything, mutation, something that's suspicious early, there are several health information or what the doctors can do to help you downplay the progression of the disease and even achieve a cure. Another thing, you must, anytime you go to the hospital, you must ask the doctor if your doctor is not putting hand in your anus, what they call digital rectal examination. Digital rectal examination is one of the important examination or exam that is done for you that will help examine the prostate. That's the only time your doctor can feel that prostate. If you actually put your hand, if the doctor puts hand into the anus of a man, is able to assess the prostate, he will know where the prostate is enlarged. There is something on the prostate, they call it sulcus, median sulcus. When there is a cancer, most times it will be obliterated. And again, when it is firm, when it is hard, or when it has something like nodule, there is a time you can do that test, that exam, digital rectal examination, and suspect a cancer because of your findings. You know, you might not be able to take your finger around that swelling, meaning that there's local infection, local spread of the disease. Then you should be able to tell. But when you do this early, they are able to see that, okay, no, prostate is fine, it's not enlarged. You know, the normal findings of the prostate, they will know your prostate is healthy. Okay? Anytime you have a need for general examination or a doctor is examining you and the doctor has not done digital rectal examination, you can remind your doctor, say, sir, they said the digital rectal examination will be the complete examination. If you are examining a bad, you can just laugh politely and say that, okay? Your prostate should always be examined when you are above 40 years, because there are a lot of things that can be found there that can help you prevent disease that is associated with prostate enlargement. So prostatitis, when you hear that, it's inflammation of the prostate, okay? And when the prostate is enlarged, you can treat infection. When that is treated with antibiotics, that can actually resolve. Prostatitis does not mean enlargement of the prostate. It means inflammation of the prostate. Anywhere there's inflammation, they can do urine MCS can guide. If you have the secretion, the fluid from the prostate in the urine, it can help reveal the microorganisms or the bacteria or whatever infection that is there. And if you do sperm MCS, it can also reveal it, because I told you that the fluid that comes from the prostate can be part of this. It's part of the sperm, not can be part. It's part of the sperm. Since it's part of the sperm, when you do urine MCS, you are able to catch whichever organism that is responsible in prostatitis. So what do you do when your prostate is enlarging? When prostate is enlarged, which is benign prostatic hyperplasia, the symptoms I told you earlier will be there. All right, you need to talk to a doctor. They need to examine you. They need to examine your prostate. They need to do a blood exam too, to also check the prostate specific antigen and see the values. And they will now tell you that it's benign prostatic hyperplasia, meaning it is not a cancer. If it is not a cancer, there are several ways of management. One, they can give you drugs that will help you screen, that will help you shrink the size of the prostate. There are a lot of people following the drugs they have been given. The symptoms will be relieved, and once the symptoms are no more there, you just continue to live and continue to take your medication. But there will come a time to some people that medications will not work for, and they will not have acute retention, or they will have significant obstruction that is causing hydronephrosis, like I told you earlier, that is beginning to affect their kidney function and all that. So they might have to go do surgery. And some of them, before they go for the surgery, they can look for another way to divert urine. They call it a suprapubic cystostomy, where they will now put a hole somewhere on top, below the belly button, on top the male organ. They put a hole there to the bladder and put a catheter so that one can be draining the urine before they attend to the obstruction. So there are several care for that. When medical care fails, there will not be need for surgery. So what kind of surgery do they do? There's open prostatectomy, where they open and remove the prostate. There's another one they call transurethral resection of the prostate, where they have to pass a scope through the urethra, where urine passes now, to go and burn off and cut off the prostate bit by bit. Transurethral resection of the prostate. There's actually a television that they are seeing what they are doing. They begin to reset the prostate bit by bit. I won't bother you with that. But these are options. There are other options for removal or reduction of the size of the prostate. But the commonest one is the one I told you now, the transurethral resection of the prostate and the open prostatectomy. Do you know that there are also problems that are associated with post-prostatectomy? After surgical removal of the prostate, BPH, some people will have incontinence, okay? Some people will have urine incontinence. Some others will have impotence. It's sometimes very challenging, but there are some people who, it's actually 3 eyes, okay? Infertility, because the prostate, I remember telling you that it supports, it produces secretions that supports the fertility of a man. So, whereas some people can actually have these surgeries and will not have these complications associated with it. I've seen both. I've seen somebody who had prostatectomy, there was no incontinence, and these other things didn't follow. I've seen somebody who had prostatectomy and was now on a urethral catheter and carrying a urine bag in his trouser. Wherever he goes, he will hide it, because he doesn't have the control over the urine again. And that's what they call the Kegel exercise, K-E-G-E-L. Kegel exercise is the exercise too that can help you strengthen the pelvic muscle and also help reduce the size of the prostate. It's actually advisable as a young person that your prostate is not systematically enlarged yet. Maybe you are 50 or you are 45 or above 50 or thereabout, and you don't have symptoms from a large prostate. Yes, the Kegel, you can go Google that up. Kegel exercise will help tense or strengthen the pelvic muscle that will help you shrink your prostate or watch the size of your prostate. This exercise too, they use it in treating incontinence. They use it in treating incontinence occurring from the symptoms of prostate enlargement or incontinence occurring post-treatment of prostate enlargement. These are the things you need to do. All right, and I've seen studies that tend to be going everywhere. I was not part of that study, but I'll just refer to it briefly. It has been said that there were studies that were done that people who have frequent intercourse is a form of exercise that will help them shrink their prostate. That is if you are married. If you are not married, you don't have a right to such opportunity. You better go for Kegel exercise. If you are married, the wife can help you with that, so that it will be a form of exercise at the pelvic floor that will help you shrink the prostate. Then talking about prostate cancer, for people who got prostate cancer, the symptoms in the early phase is the same, okay, because it's also increasing in size. But the problem is you begin to say they can have symptoms like blood in urine, pain during ejaculation, pain at the lower back, pain at the pelvic area. You know, this pain keeps being there. When they do a digital rectal exam, the findings from just prostate enlargement is different from the findings from prostate cancer. The etiology for prostate cancer, okay, is also not known, but it has been seen that there's actually a change there's a mutation in the DNA that will now result in aggressive multiplication or growth of the prostate cell or the prostate cells. So this mutation, most like every other cancer, this mutation is what will now result in an uncontrollable division or growth of that gland that will now refer to as prostate cancer. The risk is higher in people who have a family history, like I said, with benign prostatic hyperplasia. And it's even said that people whose relatives have got ovarian cancer, endometrial cancer, the history of cancer, they have a higher risk of prostate cancer than people without the history of cancers. Habits that are associated with cancer in general can also increase the risk of prostate cancer. What is one magic thing you have to do? Routine digital rectal examination when you have a family history. When you have a family history and you are above 40 years, you must do routine prostate-specific antigen. Like I told you, there's the value that is in keeping with cancer, and there's the value that you say, okay, this one is in keeping with benign prostatic hyperplasia, that's prostate enlargement, that is not a cancer. All right, so you must continuously do digital rectal exam to examine your prostate. So when it's a cancer, there are several stages. We have stage 1 and stage 2 of prostate cancer. That one is locally invasive. Local cancer, that's the cancer is restricted to the gland itself, to the prostate. When it is not locally invasive, meaning it has left the gland, it's not infiltrating structures that are surrounding the gland. For example, it cannot go to the rectum, it can go to the pelvic, all the structures are locally there. Then you call it a stage 3 cancer. When it goes to the lymph nodes, it goes to the lungs, it goes to the bones, then you call it metastatic prostate cancer. That's stage 4. So stage 1 and stage 2 is local disease. Stage 3, locally invasive. Stage 4 is advanced disease. All right, and stage 4 disease is the kind that they just watch. Most times you see them in elderly, people that are above 80. So you don't chase after them. In fact, we don't recommend surgery for them. They can, you just watch. And the reason why you do watchful waiting in such individual is that these people might have other comorbidities that will even kill them faster than the cancer you're seeing. So why do you chase after a cancer? Okay, so what it is that they might not die from that cancer because of some other pathology or comorbidity that they have got. So there are others too that you don't have to do a surgery. You do radiotherapy, you know, and support with some drugs depending on the age. I have told you, early diagnosis is very important in the management of prostate cancer. If you have a family history of prostate cancer, there should be no 2-3 months that a doctor will not push his hand through your anus for your prostate examination. They call it digital rectal examination. If you have a family history, you will do prostate specific antigen twice a year, every 6 months. Okay, 0 to 4 nanogram is the normal result per me, is the normal value. You do it 2 times a year when you have a family history of prostate cancer. If you don't have a family history and you are above 45, you can be doing once a year. And if you have done 4 and it's within normal value, you can also do twice a year. Okay, but you must keep it as part of the routine investigations that you would do. So the management of prostate cancer is dependent on the stage with which the cancer was diagnosed. If it was diagnosed early, they will starve that cancer or more. So they will look at sources of supply of hormone at that age and remove it. There was a time they were doing orchidectomy. They removed the testis. This is the gland that produces testosterone. They will remove it so that there won't be hormonal supply to the prostate. It has actually been seen that there's a relationship between prostate cancer, prostate enlargement, and hormone, because it is said that for people who had their testes removed before puberty, they never had hyperplasia. They never had hypertrophy of the prostate, not to talk about prostate cancer. So meaning that it has a relationship with the hormone that is secreted by the testes. Okay, so hormone supports the growth of the enlargement of the prostate or the cancer of the prostate. Routine prostate-specific antigen analysis is very important. You can have a record, you can have a card where you put it down every year so that you will study the trend, and the trend can help early diagnosis. So for people that are presenting late, it will not depending on the age at which they are getting. There's actually a statistics for that. For prostate cancer, 90% of people with prostate cancer will survive 1 year after diagnosis. 50% will have 5 years survivor. You know, the more the number of years, the lower the percentage of survivor, or the percentage of people that will survive as the year goes. So early diagnosis is a tool. You must get that done, and you must also seem to be involved in things that will support prostate health, diet that will support prostate health, and be active. Watch your weight. I have videos on watching your weight. Weight watching or losing weight is a very important component of healthy living. I have a video on healthy living. Go watch out that video. It will help you for almost everything. So you must have a routine exercise, you know, pattern. You must have a regular routine of exercise so that you'll be able to live healthy and prevent disease. In fact, if the disease is already there, it will also improve the prognosis. It will improve the management. It will improve the care if you have a routine exercise. Hope you've learned something. Prostate health, this is a must watch for every man, especially for what you have to eat and what you have to do to prevent it. And again, I told you it's not a disease. For everyone who've got a prostate cancer, just know that fear will not help you. Anxiety will not help you. All right? Don't be scared. In fact, being scared is like having to play a football match and have 2 zeros. You know, 2 zeros. You don't need to have 2 zeros. The cancer is already there. You must enjoy your life to the fullest, so that at least let it be 1 0, not 2 zeros. So what am I trying to say? If you've been given the diagnosis, face it with a positive attitude. Take precautionary measures. Follow your doctor's instructions. Follow your clinic follow-up. Do all that you have to do. If it is in the advanced stage that it was diagnosed, prepare your family. Live happy with family. Make peace with all men. Enjoy your life. Enjoy the remaining days of your life. Man must die whichever way, okay? Nobody is going to remain in this world without dying, except there is the Messiah comes to rapture his people. Otherwise, everyone will get to a time in life and die. So you don't have to panic. You don't have to be anxious. I know it is not easy, but being anxious, panicking will not also help you. In fact, it will worsen the prognosis. It will kill even faster than when you face it with positive attitude. Look at everything that will help you. Diet that will help you. You know, lifestyle that will help you. Lifestyle changing, lifestyle modification. Love that will help you. Explore everything that will help you and ensure that you enjoy your life to the fullest. And for you that do not have the diagnosis yet, do everything possible to have a good prostate health. Like I've told you, it is not a thing that you can pray out of your life. It's to just ensure that you manage it very well so that you will not have symptoms from it. Yes, like I told you, it has 2 phases of growth. The one that doubles at puberty and the one that starts to grow again at 25. It will keep growing all through life. So your lifestyle habits will not be what will slow down the growth and enlargement to ensure that you don't have symptoms from it. Hope you have learned something. Share this with a man. He's a man that's got a prostate. Share it with your brothers, with your uncle, with your daddy, anyone, any man in your life, okay? So that they can learn and gain knowledge that will help them. Hope you've learned something. Thank you so much. It's Dr. Kate. I'm always here to give you information that will help you prevent disease. Have a good day. Bye.